welcome to the University of Maryland's School of Public Health Admissions Q&A session. We're here to answer your questions about our graduate academic programs and the admissions process. This event is estimated to last for about 1 hour and will provide opportunities for Q&A at the very end. Facilitators for today's event are Britt Saxig, that's myself. I'm the Director of Graduate Student Services at the School of Public Health, and also Lena Duarte, who is the Recruitment and Admissions Coordinator. And she is a great resource and a graduate of our MPH program. Just a little bit about the University of Maryland School of Public Health. We are located on the College Park campus of the University of Maryland. Our campus is the state's flagship university and one of the nation's preeminent public research universities. A global leader in research, entrepreneurship, and innovation, the university is home to more than 41,000 students, 14,000 faculty and staff, and 377,000 alumni, all dedicated to the pursuit of fearless ideas. We are the only School of Public Health at a state institution in Maryland, and we have been accredited since 2010. With more than 2,500 students in 25 different degrees and academic programs, we prepare students to tackle complex and emerging public health issues and make meaningful contributions to the health and welfare of individuals and society. We do this utilizing all of the tools of traditional public health disciplines and in collaboration with fields as varied as engineering, arts and humanities, business, and public policy. The University of Maryland School of Public Health has been active during the COVID-19 pandemic. Our dean, Dr. Boris Luzhniak, has extensive experience as a career public health service leader and was a U.S. Deputy Surgeon General from 2010 to 2015. And we know that there is tremendous uncertainty about next year due to COVID-19. The University of Maryland has formed a campus advisory group that is actively planning for a phased reopening of the physical campus, guided by our School of Public Health expertise. The UMD framework for planning the reopening includes prioritizing the health and safety of every member of campus, the campus community, and making decisions grounded on our values of equity and inclusion. We are also campus leaders in online education, and many of our core public health instructors have extensive online teaching experience. This knowledge and expertise of the School Public Health team allowed us to rapidly shift to remote teaching for the remainder of the spring semester. If a phased reopening includes online instruction for fall 2020, the School of Public Health is fully prepared with expert online teaching and mentoring capabilities. Our school has assembled a team of experts to support Maryland COVID-19 decision makers at the university, county, and state levels. Our faculty and students are also working to keep the community informed about COVID-19 by hosting virtual events, providing expert advice, and creating resources for families. For example, we also hosted a community conversation on Facebook Live to discuss racial, ethnic, and socioeconomic disparities in the COVID-19 pandemic with the participation of legislatures, health professionals, and other experts. Some of our future webinars will include global health perspectives and the impact of COVID-19 in Latin America. All of our webinars, virtual events are open to the public, and you can access a recording of these events on our YouTube channel. Our world-class faculty is actively involved in and leading research, education, policymaking, and service in Maryland, nationally and globally. School leadership and faculty have created this SPH COVID-19 projections team, for example, to support the Maryland Health Department, along with the health departments from local counties such as Prince George's, Montgomery, and Anne Arundel, by evaluating the various coronavirus intervention strategies for these counties. The team is analyzing a wide range of data to provide statewide projections for demand on hospital and intensive care beds, as well as ventilators under different response scenarios. These analyses help state officials plan out next steps on the coronavirus response, like Maryland's decision to relax outdoor recreation restrictions and allow elective medical procedures. Many of our students and alumni are also actively involved with state and local health departments in this response. And some of our students currently are acting as contact tracers for the local health departments. For example, a number of epidemiology MPH students are using these roles as contact tracers, et cetera, to satisfy their MPH internship requirement this summer, starting now and into the summer. Within our university, there are our School of Public Health. There are 4 school-wide research centers and 5 department-based research centers in the School of Public Health. These centers offer many student opportunities for hands-on research and community-based experience. And for example, the Herschel S. Horowitz Center for Health Literacy is the only such center located in a School of Public Health in the country. So they provide great resources as well as many opportunities for students for funding through extra funding or graduate assistantships. And now I'm going to hand it over to Lana to talk a little bit more about our programs and internship experience.
I think I'm unmuted now. Can everyone hear me?
Yeah.
I hope so. So welcome. And I'm going to talk to you a little bit about the experience of being a Maryland student. So we are located in a short metro ride from the nation's capital, giving us access to leading health research, policy, and advocacy organizations at which our students can gain unparalleled hands-on experience and a competitive advantage. We call this the Maryland experience. Our students find both internship and job opportunities throughout the region at local and state health departments, diverse federal and military agencies, international NGOs and agencies, nonprofits and community-based organizations, professional organizations, private industry, and legislative bodies. This map shows how advantaged the University of Maryland School of Public Health is. You can see some of the organizations our students have interned, and you can see at the top of your screen that you are really close to Baltimore, where we have several national level organizations like the CMS, and we have DC that is just like really close. We also have, that's not shown on the map, the capital of Maryland, in which our students do a lot of work with the state administration. Our MPH graduates, based on our 2018 commencement data, we have a 95% placement rate for our MPH MHA students, with 88% finding employment immediately after graduation, 7% continuing their education. Many of our students end up finding employment with their internship placement sites. We have a 100% employment rate for our PhD graduates, both in academic and non-academic positions. And one very common question we receive is, where are our students now? So you can see here that our MPH graduates are working on a variety of sectors. They are data analysts and emergency preparedness coordinators in healthcare organizations. They are health service researchers and quality assurance specialists at federal organizations such as the NIH. Our MPH alumni are program managers, research statisticians, and epidemiologists. The state and local governments such as the Arizona, Maryland, and Tennessee Department of Health, and they are also in a large number of counties countrywide. They also are consultants for for-profit organizations, administrators, and researchers in academic institutions. Our doctoral graduates are postdoctoral fellows, faculty, and lecturers in academic institutions and in federal government agencies such as the National Institutes on Minority Health and Health Disparities and the FDA. And some who decided to pursue careers out of academia occupy usually senior positions in leadership positions in nonprofit, healthcare, and for-profit organizations. Students have many opportunities to get involved at SPH year-round, including student organizations, school and university-wide organizations and events, competitions, and community and service activities. As Dr. Saxvig previously mentioned, during this time of crisis, many of our students are volunteering for COVID-19 contact tracing and supporting faculty research and supporting faculty research that has been essential to build Maryland's response to COVID-19. They are also great innovators. So we do have a group of students who developed an online application to provide information through bots on COVID-19. We offer over 25 academic programs in the SPH, undergraduate, graduate, as well as certificate programs. We are excited to be launching a new dual MPH, Masters of Community Planning, this year. Our Masters is structured as a 45 credit program with 14 degrees of core courses and opportunities for students to select courses that align with their personal interests. Students can choose courses from any department within the school or other colleges and schools in our main campus. And there are also opportunities to take courses in any institution member of any of the 17 institutions who are part of the Washington Consortium. There is flexibility for full-time and part-time enrollment as well. So 2 deadlines. So we have extended the application cycle until June 1st. The application is a 2-step process: the SOPHAS application and the UMD supplemental application. The UMD supplemental application is generated by the graduate school within a week of SOPHAS verification. Admissions committees are now reviewing applications as soon as the supplemental application is submitted. We are in the end of the cycle, so the turnaround time has been of 2 weeks, no more than that, for you to receive a decision. This is the SOPHAS programs application for deadlines for 2021. I will share a series of documents with you now so that you can get these deadlines and details, and I am all ears if you need to ask questions about this. So for those who are interested in starting a graduate program in 2021, and these are our SOPHA program. These deadlines that you see on the screen are for our SOPHA's programs, domestic applicants for spring and fall 2021. I've shared the detailed handout in the chat box, and the SOPHAS portal will be open on August 28th, start receiving applications on August 18th. We want to open up the time now for you to ask questions. We are going to start by answering the questions that were submitted in the registration form. In addition, please write your questions in the comment section below in the chat box, and we'll answer them as we go.
There's one question about the path our dean, Dr. Boris Luzhniak, has taken to become a public health professional, and one of our faculty, Dr. Paul Turner, who's with the Maryland Institute for Applied Environmental Health, is also on here. So Lana or Paul, if you have anything to add to what I'm going to say. Dr. Luzhniak did medical school first and then went into MPH, but he is a long career public health servant. He has had many roles in public health for the United States government, which included the acting surgeon general, but also leading a number of different agencies. And I don't know if there's anybody that has any other information to add about that. He has, you can see many of his presentations on YouTube if you wanted to find out more information about him. We can also provide more information later if you're interested. We have one question about deadlines. Each graduate program has a way of dealing with the GREs, which are required for most of our programs. However, due to COVID-19, many of the programs have developed a waiver policy for GREs, since many people haven't been able to take the GREs due to the closures. We encourage you to contact the graduate director for the program that you're applying to for their specific guidance on the GREs. Some may be waiving the GREs, some may be giving provisional admits. It really depends on the specific program. So there's a question about the Peace Worker Program for returned Peace Corps volunteers. I'm not actually familiar with the Peace Worker Program. Our school does not have any specific agreements with Peace Corps and returned Peace Corps volunteers at this time. And if Peace Worker Program is one of those programs where there's a special funding or assistance for returned Peace Corps volunteers, we do not have that at this time.
Sorry to interrupt. So SOPHAS still has waivers available for Peace Corps volunteer participants.
There's a question about priority and final deadlines. So priority deadlines are the early deadlines. The priority deadlines are for people when applications come in, say by December 15th for that priority deadline. Admissions committees will review those applications first and make decisions on those applications first. The subsequent deadlines, people will still be able to submit applications, and from that point on, it will be a rolling basis. If there's room, if there's availability for spots, then subsequent applications will be reviewed and decisions made based on that. And for PhD students, there is implications for funding. So so for PhD applicants, you really should get the application in by the priority deadline so that you have the best chances to be considered for funding if that is available.
But can I add a little bit to the priority and kind of final deadline?
Sure.
I think the student was also asking about, does that mean that there's a commitment on the student's part with either of them? And it doesn't.
Yeah.
There's no commitment by applying but before either of those deadlines. It's just that the committees will review the first set and then they'll do a rolling review of the second.
Mm-hmm.
So, that's what the process is.
So there's a question about the maternal and child health program and whether a master's degree is something that will be developed. At this point, there is no master's, and if there's one in the works, I'd have to check with that department, but at this point, there is no master's MPH in maternal and child health that is being planned. We do only have a PhD program in maternal and child health at this time.
There is another question in the chat box about asking if our admission process is different for international students. So you basically, international students have to follow the same path as domestic students, only that for providing transcripts, you have to have them evaluated by, for SOPHAS purposes, you have to have them evaluated by an accreditation body. SOPHAS only uses WES. I will share this information in the chat box as well. And you have to provide proof of language proficiency.
We have another question about, is June 1st the only deadline for fall 2020? That is our final deadline. June 1st is the final deadline for applications. So we encourage you to get your application in by June 1st. If you have any questions or issues related to that application in terms of the deadline, please reach out to the graduate director for the program you're applying to. You may submit your SOPHAS application before all the transcripts are in, before some of the material is needed. So you can submit by the June 1st deadline. The actual final deadline is for the supplemental application, which comes out of the University of Maryland, and that's June 22nd. But before you can get the supplemental application, you need to have your SOPHAS application verified, which could take 2 to 4 weeks, depending on how many applications they're going through at the time. So another question about priority deadlines. does this affect your chances of being selected for admission, or is this mainly for financial assistance distribution purposes? So so for PhD students, it does have an implication for that, but we do want, it would only, the priority deadline would only affect your ability for admission if all spots are filled up based on the priority deadline applicants. So really, we encourage applicants to submit for the priority deadline so that you are on the first review of applications. But like we said before, applications will be reviewed after that time, all through until the deadline as spots are available. So another question, upon completion of the program, are graduates qualified to take the CHES and CPH exams? Yes. And for the certification and public health exam, those will be based on completing the core public health courses. We call these the SPHL courses, and those are 14 credits. You will, all students will complete those by their third semester in the program. And the CPH exam is based on those core SPHL classes. And the certified, the CHES, the Certification in Health Education exam, it would depend on the program. If you're in the Behavioral and Community Health program, I believe is one that is really focused on CHES. More information, if you want to reach out to the graduate directors for behavioral and community health for more information on that. Okay, is space still available for all MPH departments for fall 2020? All programs are still reviewing applicants at this time. So if you submit an application—
Dr. Satvig, we can't hear you well.
Okay, is this better?
Yeah, and I don't know what it is. There is a metallic sound in your microphone.
Let me get off, Atlanta, if you want to answer while I—
So I couldn't hear which question you were responding to. If you can just give me a heads up.
Is there space still available for our programs?
So our deadlines have been extended to June 1st. So we do have spots available, mostly in our MPH programs. Our PhD applications have finished, and deadlines were finalized in March this year, but our MPH programs and our MHA programs and our online programs are still receiving applications, and we encourage everyone to apply. There are some recurring questions that that always appear in the chat box, and I do have a few clarifications to make. Some of you have asked about the possibility of doing the courses on a part-time basis. Yes, our programs have part-time options, and they are flexible and welcoming for students who work. Almost of our classes are offered in the evening, starting at 4 p.m. So that is it's purposefully created in order to accommodate those who need to study and work. And I advise you to contact the graduate director of your program in order to learn a little bit more about the track that you want to apply for, and how you can design a coursework that works for you as a part-time student.
There's a question about scholarship funding for MPH programs for this fall. We do not offer scholarship funding for our MPH students. MPH students are However, once you're accepted into the school, you can start applying for jobs that are available as graduate assistants or graduate TA through the university job system. It's called eJobs. And many of our MPH students are able to find jobs on campus, whether they're in the School of Public Health in some capacity, or if they're outside of the School of Public Health anywhere on campus. Sometimes it may take a student more than one semester to finally find a job, but the persistent students usually can find something at some point during their 2 years as a CHIRP. So there's another question about UMD providing financial assistance if you're a federal employee. So that might be something that's listed on the University of Maryland Graduate School website for financial aid. It would not be administered through the School of Public Health. I don't know if Lana or Paul, if you have any input on that.
I don't. Dr. Paul, maybe you could respond to the question that Mohammed has posted up above. Like, he is asking, he's interested in joining UMD SPH as an applied environmental health PhD students in 2021. And he would like to know about funding and for how long the funding is offered.
So Mohammed contacted me yesterday and has started a conversation, but the basic process is that we don't take a student on for our PhD program unless we have a minimum of 1 year and typically more than 1 year of funding. And when a student applies to the program, we would link them with a potential advisor, and we would then seek initially funds through their advisor through grants. If there isn't money directly available through grants, we would then, we have quite a number of teaching assistantships. And so we would secure one or other of those approaches to bring students in. And then on a rolling basis, we would then be looking each year at sources of money for that student to be able to continue. We've never had a situation where a student that's already in the program has not been able to secure continuing funding, and we would prioritize students within the program as opposed to bringing in new students. And so it's something that we would actively work with the students. Initially, at the outset of a PhD students program, we would be providing an additional kind of bonus, dean's money funding to try and bring in strong students, which is just a first year additional component. So we would be working with those students. My advice is that any PhD students applying is to contact both the grad director of their program and also, more specifically, an individual faculty to be the advisor, so we can work on exactly what that funding will look like for that incoming person. So Mohammed, my suggestion is that Amir Sakota would be a very good person for you to now initiate a discussion.
We'll just go back to the deadlines that someone is asking here in the chat box. Like, CS, I don't really know who you are, but so you're asking about clarification about the deadline. So the deadline to apply for SOPHAS is June 1st, and you have to submit your documents by June 1st to SOPHAS, including the transcript.
June 1st is the deadline in SOPHAS for getting your application submitted. You can submit your application in SOPHAS before those documents are all populated in your application, so your transcripts can come later. However, the final deadline for fall 2020 supplemental application is June 22nd. And so, yes, you may submit and your transcripts and everything can come later, but it shouldn't come too much later, because the final decision and verification needs to be done before the June 22nd deadline. Does that make sense? And so there's not as much room when you're at the final deadline to get all the materials together. So but you do have some leeway and hit submit, but your application will not be reviewed until the transcripts are in and your supplemental application has been completed. So it's kind of a complex thing, but when you're down to the wire at the very last deadline, there's not much room, not much time that you can take between submitting and your transcripts and recommendations are fully populated in your SOPHAS application.
Another question by Yael that is in the chat box is there prior work experience required for MPH program? No, our MPH programs do not require previous work experience. So you can apply as soon as you finish your graduate degree. Our review, the application review process is an holistic process. It takes in consideration not only your GPA and the documents, but also your statement of purpose and your letters of recommendation. So of course that if you have a little bit more experience, that may count, but you can you are not required to have work experience to apply to any of our program, any of our MPH programs.
And there's a question about for mid-career professionals, is it possible to complete the MPH in 1 year? Unfortunately, it is not possible to complete everything in 1 year. We do have the SPHL courses that are on a schedule. You start in the first semester and it goes until the third semester of the program. And you also have requirements that your program each program will have, and courses are spread out during those 2 terms, 2 full years of the program. Sometimes students can shorten the time they're in the program by maybe a semester by taking summer classes. Everybody is available. There are courses available during the summer, but they may not be a required class that you need that will take place in your 3rd or 4th semester. But each program is different, and if you go to their website, they will have sample course schedules that you can go through for full-time and part-time students, and you can take a look at when courses are offered to see if it's possible to shorten your time by maybe a semester. Also, I'll say that if you're accepted into the program, you can start taking classes during the summer term before the fall semester begins. Many students will take an elective course during this time for their program, or there's a data analysis class that is pretty popular where students learn SAS. But there are elective courses that are offered during the summer, and some global public health courses that are offered during the winter term. And I'll just say that most of the summer courses are all online, and the winter term global public health courses are hybrid courses, so part online and part in person. And students can also take elective courses anywhere else on campus if that's something of interest to you. And some other programs may have online summer courses or winter courses that you can enroll in. So somebody asked when the final decision is made for admissions. Final decisions right now are being made on a rolling basis. So once an application is submitted, it's being reviewed and decisions are being made. So if you go ahead and submit your SOPHAS application today, you should have your professors send their recommendation letters within a week or 2, because you don't want to have so you want to get them set it in, but you don't want to wait until June 22nd. I would try to do a few days beforehand so that you can get that supplemental application sent out to you. When does the semester begin? So the semester will begin on August is it August 28th this year? I should have my calendar up.
August 31st.
August 31st, okay. Our new student
And
orientation will be on the 25th of August. And there was a question, I graduated from undergrad 12 years ago. We understand that many applicants who have been out of school for a long time may no longer have the contacts that they had with their undergraduate faculty. And so if you do not have access to a faculty member to write you a letter of recommendation, employers are fine. You might give them some tips on how, on what they put into their letter, and to kind of highlight your characteristics that would make you a great candidate for graduate school, and what skills you have that would help you succeed in graduate school, to be able to address those kind of topics. So if you're enrolled in an online program, so there is a difference in tuition if you're in an online program versus an in-person program. The online programs are administered by the Office of Extended Studies, and the tuition for those programs is determined by that office. And the tuition for starting in fall 2020 has not been posted yet either. That will come later in August.
Jamie is asking if there is difference in state and out-of-state tuition. Yes, there is a difference in state and out-of-state tuition.
And I'll also mention that the School of Public Health has what's called a differential tuition. A number of colleges on campus have that, so it's slightly higher than the base tuition for most graduate schools. And so you need to look at the tuition that is posted by the School of Public Health to know what the differential tuition is for our school. I'll add that one other thing that the University of Maryland has going for students is that it's called the Washington Consortium. And students, if you find that there's not an elective course that you want to take on campus, maybe there's a course that you want to take at George Washington University School of Public Health. Through the Washington Consortium, our students can register and take those courses if space is available, and pay the University of Maryland tuition cost. You would not have to pay the George Washington University tuition cost. And students are also able to take courses up at the School of Medicine. They have a number of epidemiology and public health courses there. And so there's a lot of flexibility for students in terms of that Washington Consortium and agreements with University of Maryland, other University of Maryland campuses. You can find out more about that information on in the graduate catalog that is on the graduate school website, if you're interested in pursuing that a little bit more. And there is a lot of opportunity for research, getting involved in research at the School of Public Health if you're an MPH student. And we try to keep our enrollment manageable so that there is opportunity for faculty to interact with students and provide support to students during their time as a MPH student. And so you find that many of our classes have at most 80 students in the core SPHL classes, where every MPH student is taking a class together for all programs. But once you get into your program specific courses, class size at most will be 40, but usually they're 20 or less in those classes. So it gives you a lot of opportunity to interact with your faculty, with your professors, with the TAs, with guest speakers, etc. So I think it's a great way to really expand your experience at a School of Public Health.
I just want to reiterate that our events that the school is running several events related to the pandemic. There are great resources. We have great faculty and guest speakers that give excellent input on what the role of public health is at the moment, and how important it is to be in this field, and how crucial public health workers are to responding and to providing guidance for policies at this moment. So Some webinars are on the making, and just keep in tune with our social networks, with our social media channels. It's open to the public, anyone can register.
And I'll also say that if you're an applicant and are interested in talking to a current student, that's something that you can talk to a graduate director about, getting linked in with a current student to find out about their experiences at the School of Public Health, if that's of interest. Again, the question is, do we need GRE score to submit fall 2020 application? Please reach out to the graduate director of the program you're applying to, and they will be able to advise you on what the requirements are. A number of our programs are either waiving the GRE for this due to COVID-19 or providing a provisional admit if you do not have a GRE, but they can give you the best advice for their particular program. There's a question about the difference between doing an online degree versus an in-person degree in the event that all degrees must be done online. That's an interesting question. And I don't know if we can answer that. So our faculty are trained and to do, most of our faculty have experience doing online education. There is a difference in that the online programs are built around being online programs. So the whole delivery, the mentoring, the resources of an online program are already established. If an on-the-ground program moves online, those kind of that infrastructure would need to be built. Chances are that we will not, that programs going forward would not be fully online for on-the-ground programs. There may be some kind of hybrid approach in the fall where there's some courses that are online, some courses that are in person. I don't anticipate that on-the-ground programs will all be moved to online going forward. That answers your question. But more information, at least in terms of the University of Maryland School of University of Maryland School of Public Health should be coming by mid-June. We should know what's the status for the fall. So there's a question about difficulty getting your transcript from your undergraduate institution. So if you're submitting to SOPHAS and you have a difficulty with your transcript, you can contact SOPHAS directly and they'll be able to advise you. And they may even reach out to the registrar of your institution to give them some guidance on what to do. But definitely for our purposes at the university, you could send us your transcript, but SOPHAS you'll need to talk with SOPHAS about what they will accept directly for their purposes in terms of verification of your official transcripts. But they do have a way of communicating with registrars from schools where there is difficulty due to COVID-19.
There's been a couple of people asking about deferral options.
Oh, okay. So if you are admitted, have an acceptance into the University of Maryland, that you would have an opportunity to defer for a year or possibly for a semester. For MPH students, deferring for a semester may be difficult because you'd be missing the core courses that you need to take during that first semester. So it would be recommended to defer for an entire year, but you have that opportunity to make that decision up until, I believe it's like August 1st. If you're accepted, you have until August 1st to make that decision to defer for a year. Or if you make a decision to defer, say June 1st, and that you defer, you can reverse your decision to defer if circumstances change all the way up until August 1st as well. So hopefully that helps answer your question. And if you are in need of a deferral, you would contact your graduate director to let them know, and then they can help you facilitate that process.
So SOPHAS will use several ways to verify your transcripts. And they have reached out to over 2,000 registrar offices, and they are in direct communication with them. And they are verifying coursework, making it easier for them to verify, to submit the transcripts for students through emails or to other means that are not only the physical traditional way of handling the documents. So you should contact, if you still want to apply for the semester, you should contact, and you are having difficulty in assessing your transcript, you should contact the registrar of your institution and check with them because they are the ones who are going to submit these documents.
And after this, if you have any questions, definitely feel free to reach out to myself or Lana. And again, any of the graduate directors for the programs that you're applying to. There's a question about how COVID-19 is shaping the research opportunities in the future of public health. I think there's definitely a lot of opportunities for public health professionals and public health students given the COVID-19 pandemic. As you can see, if you take a look at some research opportunities that NIH is putting out, or the National Institute for Minority Health, a lot of different opportunities are available.
Thank you to everyone who participated. It has been a very rich session, very interesting questions. And I just wanted to reiterate what Dr. Saxvig has said. You can reach out to me or to her at any time during your journey to graduate school, and we are here to help and support you to get where you want.
And just another plug for our location, the slide that Lana showed for where we're located, right close to Washington, D.C., Virginia, Maryland, Delaware. There's a lot of government agencies nearby where students find their internships, and students are able to find full-time positions through their internships with us. So I think it's a great location to go to a school of public health.
Our page for COVID-19 resources and update, there you can find our faculty with expertise relevant to COVID-19 pandemic. The research labs have not stopped, so you can check on that page, and from there you go exploring our website, and you see that our faculty in every department, everyone is still working, supporting not only the health department, but keep going with the good work that public health always does.
All right, well, thank you everyone for attending today, and we'll let you know if there's future events that we'll be having, and again, let us know if you have further questions. I think we'll sign off now. Thank you all.